Communication with technicians when it comes to doing diagnostic wax-up for full mouth reconstruction cases. So in this video, I'm going to discuss about how to communicate or what to communicate with technician rather than just writing it down in your prescription that please do diagnostic wax-up for this full mouth reconstruction case. That instruction is not good enough. We need to really be specific when you are discussing diagnostic wax-up criteria with your technician. However, before we dive into that, let's discuss why diagnostic wax-up is important in full mouth reconstruction cases. So first of all, it allows you to do proper visualization of your cases. It will allow you to see how the finished result will look like. Maybe you've done hundreds of cases and you know how the case will end up looking like. However, patient may not have that understanding, and that's why it is really important for patient also to visualize. When you're doing a mock-up in patient's mouth, patient will be able to visualize how the treatment will look like at the end of the plan. So first of all is visualization. Number two is treatment planning. It will help you with treatment planning and giving patient better estimate for the treatment, because let's say you're doing diagnostic wax-up in the beginning, patients come to you and say, do you know, doc, I just want a functional result. I don't want anything much more aesthetic. I'm not really into cosmetic things, just want functional result. I see my teeth worn down. I want them to last longer in my mouth. And you understand that and you say, look, let's do that. Create a functional wax-up, and you do the wax-up, you finish the treatment and patient like, when I smile, the teeth looks weird. They don't look really nice. I want more aesthetic result as well. Now that's too late because you finished the treatment already. Of course, you can go back and do veneers and do all this treatment, but it will now cost patient more, and patient might not be willing to part with their money because they already committed to the treatment. So when you're doing treatment planning, that will help you. And diagnostic wax-up will help you sort of plan the treatment and give patient an accurate estimate. It will also help you understanding how much restorative space you have posteriorly. Now, anteriorly, generally, when you open vertical dimension, you're going to have more restorative space than posterior teeth. And that's where it helps, because when you assess the posterior teeth, and if you don't have enough space for indirect restoration, then you need to go with direct restoration, and that will also impact on your treatment planning, your fees, or your estimate of the treatment as well. So it helps you with visualization, it helps you with treatment planning. It will also help you with communication, which is really important when you are doing full mouth reconstruction. You want to be super clear from the beginning with the patient what kind of end result they're aiming for. So when you are communicating with patient, you can really tell them that this is the shape, size, smile line we are going for. Is this okay with you? This is how they will feel, because I always do mock-up in patient's mouth. So when you're doing mock-up, you are kind of allowing patient to test drive the final result so that patient can understand how it will feel. So it really helps with communication. It also helps with communication with technicians, because once the technician, let's say, done the wax-up, which is not to your satisfaction, you go back to technician, you discuss with technician, look, I'm planning to do this, this, this. And when the technician sends back a correct wax-up, you now know that technician has an understanding how this case is going. So in the future, when you're doing restorations, indirect restoration, technician knows exactly the anatomy, the morphology of the restoration, and how to create those restorations according to your needs. And number four, it helps you with provisional restorations. For indirect cases, you are going to put provisional restoration. If you have a diagnostic wax-up, that will help you create an accurate provisional restoration to your final result. And that will again help patient to visualize and get used to with the new result. So these are the benefits of doing diagnostic wax-up. Okay, so now let's come to what are you going to communicate with the technician when it comes to doing diagnostic wax-up. So number one, obviously you're going to fill out the patient details and when you want the work back and all that stuff, your practice detail, your details. Number one, you need to let the technician know what are your goals. Are you going to give patient better aesthetic result, or are you just looking for function? Are you going to change any incisal edge position? Are you going to change any teeth position? Are you planning to do orthodontic treatment after doing full mouth reconstruction, which is not really recommended, but there are certain cases where you would want to do that. Are you going to close the midline diastema? Are you going to leave the midline diastema? So you need to really write down patient's goal and your goal for full mouth reconstruction treatment. So that comes first. After that, you're going to really explain to technician what kind of restoration are you going to do. tooth by tooth. So I would write down upper right 1, palatal incisal composite. Please do not cover buccal area, because many times what happens is now more or so with digital diagnostic wax-up is technician will have a library of teeth and they will just literally drop that library in patient's mouth and make smile look really beautiful. But that might not be your plan. You may have proposed with the patient that, look, we're just going to do palatal incisal restoration, see how the aesthetic look like, and then if you want buccal veneers, then we can always top it up with buccal veneers at the end of the treatment. But if the technician sends you diagnostic wax-up with doing buccal veneer, that happens most of the time if you haven't given any clear instruction to technician, then patient will look really nice, patient will be really happy with the result. And then when you do just palatal incisal build-up, patient will not get the exact result what you did for diagnostic wax-up. And that is the most amount of issues I find with my mentees when they send the wax up to the technician, comes back, and then when mentee sends me the wax up for an assessment, I see that the technician by far put more wax on the teeth than needed, cover more surfaces than needed. More importantly, like lower anteriors, many times you end up doing incisal build-up. Many times technician will cover the buccal area as well when you haven't planned for it. It's not that they are not needed. Many times patient may not be able to afford the veneers. They just want something more sort of medium term to a temporary result, and you plan just incisal build-up, but you do need to let the technician know. So again, tooth by tooth treatment planning. So I would tell technician upper right 1, palatal incisal composite build-up. Upper right 7, just say I'm planning to do a Emax onlay, and lower right 7 Emax onlay. Now, when technician is doing the wax up, you need to let the technician know that, look, this is an onlay, not a crown. So don't put the wax on completely the buccal surface. Just put the wax on the occlusal surface, so or 1 millimeter covering the beyond the occlusal surface, just to mimic the onlay preparation and onlay fit, not putting the wax up in the on the whole tooth. So you're going to tell technician tooth by tooth what kind of restoration you're going to do. Then you're going to let the technician know a little bit more in detail, maxillary teeth, how much increase of the incisal edge you're going to do, if you want any space distribution. Same thing with the mandibular teeth. Do you want to have the curve of SPE flat? If the curve of SPE is not flattened, what kind of guidance do you want? Do you want canine guidance, groove function, protrusive? Do you want any steeper guidance, or you want shallower guidance? Obviously, you know, if you have read my book or you come to my courses, that I prefer flat curve of SPE and shallow guidance, because that will avoid any breaking or fracturing of the restoration, because it will not restrict envelope of function. So when patient functions, that envelope of function will not get restricted. So all these things you need to really consider when you are discussing with technician, and make sure that technician sends you a result before they finish the case. So what generally I tend to tell technician is do upper and lower 3 to 3 wax up, send me the photos or send me the model or send me the digital file so I can assess it before they just go ahead and do the full mouth wax up, and then now you have to change everything all over again. So make sure you tell the technician exactly what kind of restoration you want, but also check mid treatment, in the sense that mid process, make sure the technician sends you models. So let's say if I am not mounting models myself, I want technician to send me mounted model if I'm doing analog case, or if I haven't mounted model digitally, then I want technician to send me what kind of occlusal vertical dimension they have raised and what kind of wax up they're going to do. Although when I take CR records, I'm going to send technician exactly the occlusal vertical dimension I want, but still I want to go back and check again. If you keep checking at every single step, you won't have an issue where right at the end of the wax up, everything's rubbish and you might have to change everything because you haven't given appropriate instruction to technician, or you have given appropriate instruction but technician has misunderstood. Even the most experienced technician can misunderstand the instructions. So make sure that you check all of that. Now, I hope you found this video helpful. If you have any comment, then write on the comment section below, and I will be more than happy to help or guide you about the diagnostic wax up. I have created a diagnostic wax up guide for technician, so you can fill it out and you send it to technician so that you know that you are communicating effectively with the technician. If you want that guide, then click on the link below or comment below diagnostic wax up guide, and we will DM you or we will email you the diagnostic wax up guide. So I hope you enjoy it.